Breaking news from the Senate tonight. Lawmakers have just passed a $1.5 trillion omnibus package. The measure to fund the government has been in the works since September, and it now heads to the president for his signature. In it, $120 million set aside to reduce maternal deaths and create programs for racial and ethics bias training in the healthcare field. Senator Raphael Warnock introduced the bill last year. He spoke exclusively to our Hope Ford about its potential impacts.
The stories have long been told.
I wasn't taken seriously.
Stories of unfair treatment in the medical field.
And that caused me to have my right ovary removed.
Stories told to 11 Alive of mothers, black mothers, dying during or directly after giving birth at disproportionately higher rates.
The doctor's walking next to the bed. She'll be back in 15 minutes. And that was the last time I saw Kira alive.
According to the CDC, black and minority women are 3 to 4 times more likely to die from childbirth-related causes.
Georgia is dead last when it comes to women and their access to health care.
Senator Raphael Warnock, along with Senator Marco Rubio, introduced a bill to reduce maternal deaths.
To make sure that when women are trying to bring a child in this world, they don't have to do so with one foot in the grave, as it were.
The bill now included in the new government spending package.
We need to make sure that we've got accurate data on what's going on. And so this will help with that.
Grant programs will fund research, racial and ethnic bias training for healthcare providers, a study on best practices to teach health professionals how to reduce discrimination, among other provisions. Warnock praising the bipartisan support.
We may disagree on a whole range of other issues with respect to healthcare. This is something we ought to all be able to work on.
The hope is the outcome will be less stories of mothers dying from preventable childbirth-related causes and more stories of moms surviving to be a part of their child's stories.